A single case of meningococcal disease has been confirmed at HISD's Bonham Elementary School. That's in Southwest Houston. Now, according to the district, officials sent the school notifications to families about more information and even information to staff and students who may have been in close contact with this confirmed case. District officials say they are working with the Houston Health Department. And joining us this morning, we have Dr. Janeana White, the Deputy Health Authority with Houston Health Department, chatting with us this morning about this. Thank you so much, Doctor, for joining us.
Oh, good morning, Brittany. Thank you for having me.
We know many parents who are watching this morning or maybe perhaps received this notice, maybe nervous, maybe panicking a little bit. What can we tell them? What is meningococcal disease for those who may not know?
Thank you. So meningococcal meningitis is a bacterial infection. It's not fairly common, but when it happens to an individual, what they can become is very ill with symptoms, what we call like septicemia, which is a bacterial infection that's very serious, or even meningitis. But it's not a very common infection in general.
Okay. How does one get this? How would that happen?
Yes. Many of us hear about people who have gotten the infection. Again, I mentioned it's not very common, but you have to be in very close quarters with someone. So parents may have often heard us talk about this, particularly with sort of military recruits, because they share a very close and common living situation. We talk about it with young people as they sort of go off to secondary or a college education. So that's one of those conversations we have with our children when they're thinking about college entry. So that's a vaccine that they get as they go into college. So usually we talk about this when the close proximity of an individual requires that they're very, very, very in close proximity. It's very uncommon in young people, but young kids can also be exposed, but they really have to have very close contact. So that's what's important for parents to understand.
Okay. And doctor, you referenced, this is not very prevalent, not very common, but who is most at risk for contracting this?
So it's the very little babies. Again,
Okay.
It's not very common in that age group, but that would be a vulnerable group. It's also seen in individuals that have sort of immune deficiency sort of disorders. And we also think about individuals that have what we call like a asplenia. So that's sort of like a non-functional spleen or an absence of a spleen. That's often seen in children who have sort of sickle cell disease. And we also see it in children when I talk about immunocompromised, children who have complement disorders or complement deficiencies. And many of these children are already working with healthcare providers because these are very rare conditions. So they have already may have had these conversations with their sort of pediatrician, the hematologist, the immunologist, who's already framed it to the parents that these are children that need to have gotten that vaccine earlier, because that's one of the things that we do in that population is vaccinate them because of that risk. So really the risk is for children who have sort of that immune disorder. Then the other group that are often at risk are those teens, preteens, young adults that are going off into the college environment.
And again, I know you touched on this, but the way to prevent it, you said, is vaccinations.
Absolutely. So, most pediatricians, family physicians, our practitioners are going to talk to our parents and young people around the age of 11 and 12. That's the beginning of getting that vaccine. It's a series. It's a 2-dose series. And then there's also an opportunity to do it around 16 because there's two. There's what we say the Men A, it's got a couple of other letters in there, and the Men B. And that's the conversation parents are going to have with their healthcare provider on vaccinations.
Got it. And doctor, what are some of the symptoms and how does this affect the body?
So some of the symptoms are what parents may have seen when they have an ill child, an ill young adult, is that fever, the myalgias, just not well, not looking well. When you think about the meningitis symptoms, that's the headache that just is out of proportion for your child with headache, neck stiffness. They just don't look well. What we often will say, they look really ill. And then this infection can also bring just a a discerning kind of a rash. It has a sort of a purplish hue. It just looks deep, and what we describe as sort of a deep hue purple kind of rash. And so, you know your children, you know your young adults. If they don't look well, they have this sort of headache, and they just don't want to be touched, and they're not eating, and they have sort of this rash. You really want to take them immediately to be seen at the emergency department, talk to your healthcare provider, but they need emergent evaluation.
Yeah. And Doctor, not knowing all of, the situation surrounding the incident at Bonham Elementary School, but what would you tell parents there who have children if they've been contacted about this? What should they be doing at this point in time?
Definitely. We've given out communication to the school, and we appreciate their partnership. It's been amazing. We want parents to know that first, the health department is a resource, and we have a number that, 832-393-4220. I want to make sure I give you the right number. 832-393-4220. And the health department will be more than happy to answer any questions that parents may have, administrators may have. But, certainly reach out to your healthcare provider as a resource. And, we're just grateful to be here to help the community and allay fears and answer any questions that we can.
Well, Dr. Janeana White, thank you so much for your time and providing context to this. We so appreciate it today. Thank you.
Great.